Welcome back. This section of the show is called Ask FPA. You can send your questions to tv@fpalex.com and include your name if you would like us to use it on the air. Tonight's question is, I recently had a CT scan with contrast. What is contrast and should I be worried when it's ordered? Asked by Stephen Collins of Lexington, Kentucky. And here to help me answer that question is Dr. Jason Harris, who is the medical director and owner of the Lexington Diagnostic Center, and the marketing director, Devana Sayer. Did I get that
Perfect
right?
job.
All right.
Thank you.
Thank you all for coming in.
Thank you for inviting us.
All right. Well, tell us about CT scan, or let's answer the question first. Sure. Contrast. What is it?
So, for CT, there's two primary types of contrast that we use. One is an oral contrast, which is a barium-based contrast that people ingest for the CT study. And the other one, which is probably what they're asking about, is the intravenous contrast, which is injected through a vein, usually peripherally, and before the CT study or during the CT study to look at the vasculature. As far as the safety of them, the oral contrast, there's almost no problems with it. I mean, the things we worry about are sometimes they can cause a little bit of constipation, so we advise our patients to drink lots of fluids and after the examination. For the IV contrast, it's developed and evolved over the last 30 years and has become much, much more safer. The radiologist's biggest fear is having an anaphylactic reaction or an allergic reaction to the intravenous contrast, which can be life-threatening. Thankfully, it's very, very rare. In my practice, I've never seen it.
Knock on wood.
Yes,
there, yeah.
Absolutely. And we go through extensive training mainly just to deal with those reactions. But like I said, it's very, very rare. But in general, what we really want to practice and preach is that if you don't need it, then don't get it. And if a patient ever has a question on whether they need that contrast, they should call us and ask. Even if they're not getting the study done, we have tons of people that can answer that question for them. In general, it's usually it usually is helpful in the diagnostic interpretation of the images. There are certain times, like for instance, in the Ohio River Valley, which we all live in, histoplasmosis is endemic. And so for chest CTs, it's actually more beneficial not to give the intravenous contrast because we're looking for calcifications in the pulmonary nodules, which would indicate a benign process versus a malignant process, which unfortunately lung cancer is also very problematic for our patients.
Let's talk about some of the things you do. You do CAT scan, you do MRI, you do X-rays. For that matter, you do a lot of ultrasounds, nuclear studies. But tell us the difference between when you do a CAT scan, when you do an MRI, when you do an X-ray. What are you looking for?
So they're all very different modalities, and in general, and they all have pluses and minuses to them. A CT scan it's very beneficial. It's very quick. So a CT scan usually is performed in seconds, whereas an MRI scan is usually performed in it can take 45 minutes to an hour to perform. So if it's a patient that has an acute traumatic injury or a brain injury, you're going to want to see if they have a brain bleed right away. You don't want to wait 45 minutes. So you're going to put them on. You're going to get the CT scan. And you're going to get that done. Now, with that said, an MRI in general usually gives more diagnostic information. So, if you have the brain bleed, you may go on and get the MRI, and you want to look for secondary, problems like hydrocephalus or obstruction, or and other problems that could occur from that primary trauma. And then X-ray is really the most basic modality that we use. It's more of a two-dimensional. But it's also very good for, it's still very good for looking at bones and joints, and looking for breaks and arthritis, and looking for bone tumors. It's still a very useful technology.
Navona, you're the marketing manager, so the benefits, you're freestanding, easy to get to, and did I mention everything that you did?
Pretty much. We also do nuclear medicine and bone density scans and ultrasounds as well. So we really pride ourselves in being able to provide the full spectrum of radiology or medical imaging. And to see us, you just simply need an order and what's called a pre-certification if you have insurance, and that's something that we can help your physician get. But most of the physicians will do that for us, and then we can see you really quickly because we're open on Saturdays and in the evenings, because that's all we do is radiology.
Yeah. Now, you mentioned also ultrasound.
Yes,
we
sir.
talked about CAT scan, we talked about MRI, we talked about X-ray. Ultrasound is a sound wave test.
Sir, yes.
And good for gallbladder? That's what
good for a
I send a
lot.
lot that way.
So I like ultrasound in particular because one, there's no radiation involved with it, and it's probably the safest technology that we have for evaluating something, and it's also can be real time. So if I've got a question, I can go down there and actually use the probe and see what's going on myself, and can see things in real time as they develop. And it is very useful. So we do a lot of stones to look for gallbladder disease. We do a lot of pelvic examinations to look for ovarian and problems. And we also use it a lot for vasculature. So we would look at the carotid arteries, look for atherosclerotic disease, and peripheral vascular disease.
Great information. You do great work. The patients appreciate it. Thanks for coming in and tell us about it.
Thank you very much, Dr. Fox.
We'll be right back.